Dr. Robin Chutkan is an integrative gastroenterologist who's seen the rise in these cases firsthand. What is the status now? It's been elevated, I understand, to an epidemic.
That's right. So fatty liver disease is directly related to the obesity epidemic. And with 2 out of 3 Americans overweight and 1 out of 3 Americans obese, it's not surprising that we're seeing this dramatic increase in fatty liver disease.
Who's most at risk?
So anybody who's overweight can be at risk. And in fact, we've even seen fatty liver disease in normal weight people. But it's a particular type of obesity or being overweight. People who are what we call an apple shape, who have a lot of central obesity, people who tend to put a lot of weight on around the middle. If it's accompanied by an elevated blood pressure, high cholesterol, or diabetes or prediabetes, those are additional risk factors. And even a small increase in weight. So it's not just people who are significantly overweight. Gaining 20 pounds can increase your risk for fatty liver disease by 10%.
So Dr. Chutkan is speaking to a lot of us because that's where many of us live, which is why so many of us are afflicted by this. Maybe if I can show you why I find this so concerning. This is a normal-looking liver. And you'll notice it's brown. It's because it's normally supposed to be metabolizing things like bile, sort of greenish material, brownish material that actually makes your poop brown. And it's supposed to be this color when it's not being irritated. But when it has too much fat in it, it looks like this. You see how it's paled out here? This is from fat infiltration. Literally, fat is growing inside the liver cells and engorging them, and ultimately it begins to scar the liver. So it turns to cirrhosis. Even though most of you think you have to drink alcohol to have cirrhosis, what Dr. Chutkan is teaching us is you can be a non-drinker and still develop this problem, which is happening all over America. How long does it take for this transition to happen and for this to become fatal?
Well, you know, we refer to fatty liver disease as a silent killer because so many people who have it, and we've seen the numbers are in the millions, so many people are asymptomatic. The symptoms can be very, very nonspecific, or you can have no symptoms at all. So the symptoms include things like fatigue, weight loss or a diminished appetite, nausea, abdominal pain, particularly in the right upper quadrant where the liver is located. As you can see, when the liver develops fat deposition, it gets enlarged, and the liver is surrounded by a dense fibrous capsule. So as the liver becomes enlarged with the fat in it, it stretches a capsule, and that can lead to pain. But so many people don't realize they have it. And this is the good news is that this is a progression. So you can start out with just fat deposition in the liver, and you might stay there and never progress. But a significant percentage of people will progress to inflammation of the liver, and then the end stage, which is cirrhosis. And that's usually a small shrunken liver that's scarred. And the bad news here is that cirrhosis is irreversible, unlike the first 2 stages.
If you're one of the 30 million Americans who has some version of this, what do you ask your doctor to do to you? What kind of testing can prove that you have it or don't have it?
Well, certainly a good physical exam can pick up an enlarged liver by feeling in the right upper quadrant. But there's a simple blood test called the liver enzymes or liver function test. And if it looks like it might be fatty liver disease, I'll often do an ultrasound exam or an MRI of the abdomen. So those are imaging tests that can actually show us the fat deposition in the liver. What we generally recommend in our practice is we then put people on a very significant weight loss and dietary regimen where we try to get them to lose weight and to change their diet, and we repeat the liver enzymes in about 3 months. If they're back to normal, that's a good sign. If they're not back to normal, then the next step is probably a liver biopsy to confirm the diagnosis, and more importantly, to see whether there's inflammation or even end-stage scarring in the liver.
So I just found this scientific study. It's talking about the role of vitamin E in particular in helping stave off the disease. Can you explain this work? And there's a whole promise for the average viewer?
There is promise, and that's really encouraging because until now, the only treatment for fatty liver disease progressing to end-stage liver disease was liver transplantation. And of course, as with most organ transplantations, there are lots more people waiting for an organ than there are donors, and there are organs available. Liver transplantation. Now, when I was in medical school a long time ago, it was rare. I don't think I ever saw a case of somebody having a liver transplant for fatty liver. Now it's one of the top 3, along with viral hepatitis and alcoholic liver disease, and it's poised to become the #1 cause of liver transplantation. But again, there's a limited supply of livers. And of course, after a liver transplantation, you're on medication for the rest of your life. You're chronically monitored.
You're better off not having a liver transplant if you can, for example, take vitamin E or lose weight.
But this is a really promising...
So what do folks do?
Yes, so the vitamin E study was very promising because it suggests that you can halt the progression from fatty liver to inflammation to cirrhosis by using significant doses of vitamin E. But what I recommend is getting it from food. So there are some really terrific sources of vitamin E. Avocados, nuts, and green leafy vegetables are terrific sources. So that's a great way to get it in your diet, and those are foods that can also help you lose weight.
Dr. Chutkan, thank you very, very much.